Here in our UW Diabetes Institute, we see north of 2,500 people with type 1 diabetes, starting at age 18 and going up into their 80s and even in their 90s. Many of these patients with 50, 60 plus years of type 1 diabetes. The problem is we don't have good, robust, randomized trials on cardiovascular disease in this population. Cardiovascular disease is the #1 cause of mortality in this population here in 2024. Now, the other really important point about this difference between type 1 and type 2 is that when I was a medical student 40 years ago, type 1 diabetes always occurred in children, and type 2 diabetes, as a rule of thumb, only occurred in adults. And for reasons that we don't completely understand, that has very much changed. The frustrating part about that is you can make an argument that they have type 2 diabetes, even though they have autoimmune type 1 diabetes, but we have great difficulty in getting these patients the medications that would both help their diabetes, help their weight, help their cardiovascular risk, help their renal risk. And I suggested we write an article about the controversies, about how we extrapolate the data from type 2 diabetes and people without diabetes, put them into a type 1 diabetes-centric article, and come up with our own suggestions about how physicians should make the decisions about what should the blood pressure be, when should we start a statin, when should we do non-traditional tests like coronary artery calcium scan or lipoprotein(a), things that we didn't do in the past, but things that potentially could increase the risk of cardiovascular disease.